Welcome back to the South African Morning. The Health Justice Initiative is calling for clarity on government's plan for the COVID-19 vaccine. This includes its equitable allocation and policy approach. Discovery Health has announced that it'll be allocating funding for its members to receive the vaccine once it becomes available in the country. Now, for more on all of this, we're joined by the head of the Health Justice Initiative, Fatima Hassan. A very good morning to you, Fatima, and thank you so much for your time. So, of course, you're asking for better communication, more communication. Do you feel that what has been said to us now in terms of how much has been given, I think about 300 million rands for the deposit of the vaccine, as well as when we're going to get it, 4 or 5 months' time, is not enough communication?
So thank you for having me on the show. So I think we're just getting the first bits of information. We don't think it's enough. I mean, we've been writing to government since mid-November saying that we worry that the global shortages and the scarcity in the world and the fact that there are patterns on a lot of these vaccines and these vaccine products is going to be making it very difficult for our government to be able to procure vaccines, but then also to allocate it in an equitable fashion. We also said to them that we were concerned that because we have a two-tier healthcare system, that private medical aids would buy up what limited available supplies they were on the world market, and that they would, make sure that their members got access to a vaccine before the public sector could, and it wouldn't be based on a rational allocation framework that's rooted in the Constitution. So we're seeing some briefings now. It's definitely not enough. We need to actually be hearing, I think, more convincingly and in a longer way where we can actually engage with government. You must remember that in this disaster, it's the Minister for COCTA, the Minister for Health, the Command Council, and the Disaster Management Center that actually have legal obligations to be developing such plans and to make those plans publicly available. So, while it's important that we've heard from the Deputy Director General around some of the conversations that have been happening, the bilateral ones, including some of the communication they're getting from COVAX, which, as you know, is an imperfect voluntary mechanism on its own, and that's, a separate issue. We really have to be hearing from the people who are in the leadership positions, who are ultimately accountable in terms of our Constitution for the acquisition, but then also for the rollout. And I think what's important to note here is that we can have as much money as we want on the table. At the moment, at the end of 2020, there are limited supplies, and that's because rich countries have bought up a lot of these supplies. Pre-commitments have been made, and unfortunately, the vaccine is not being regarded as a public good. So it's being, it's still being treated as a commodity where the highest bidder can get access to a lot of dosages.
Fatima, how does government ensure equitable allocation when you have, for example, a Discovery Health with an open checkbook that is very attractive to government, and government needs as much money as it possibly can get? So government says, well, you guys have got the money, so here, take as much as you need because we need the money too. So how does government ensure that everybody gets equal vaccines?
So I think this is the difficult policy choices that our government's going to have to make. And unfortunately, because it's been very slow in communicating in a very effective way, and it hasn't done a great job at that, there's very low public trust in government. But government has a constitutional obligation, is going to have to step in. This is what we've been saying to them since November. They're going to have to use the available laws because there is a legal framework that would allow them to do that, to make sure that there isn't parallel procurement for the public and private sector, and then whatever limited supplies we get into South Africa is actually allocated in an equitable fashion across both sectors without giving preference to people who have a lot of money or who have a lot of political influence or clout. So there's certainly measures it can take. Because we're in a pandemic, there is a public health emergency. There are also intellectual property frameworks and rules that it can make better use of. It hasn't taken us into its confidence about what it will do if these drug companies refuse to share the vaccine know-how. Because remember, some of these vaccine technologies can actually be manufactured in the global south and can be scaled up for manufacturing to benefit, countries in Africa, not just South Africa, obviously, but the whole continent and in the global south. So there's certainly a lot of advances, and I mean, kudos to all the scientists and the clinicians who've worked on all of these vaccine products. But if you continue treating it as a luxury and not as an essential necessity to take many countries in the global south out of this pandemic, then that's when you will have these scarcity issues, and that's when you'll have to ration. So unfortunately, governments in this catch-22, where you have to rely on COVAX, you have to rely on bilateral conversations with some of these drug companies. But so far, our government's been very willing to take on the tobacco industry, the alcohol industry. We still haven't seen what its, unambiguous position is going to be with the drug companies who refuse to either share their technology or make a greater amount of dosages for the benefit of South Africa. And so I just really want to stress that you can have all the money in the world right now. There's limited supplies and there's a scarcity. And so while you're trying to remedy that scarcity, you also have to figure out with limited supplies, how will you ration that? So we're hearing some, input from Professor Barry Shub, who's the head of the subcommittee on vaccines for government. We're hearing from the DDG, we're hearing from some other experts, but there needs to be alignment, and I think that can only be through a written plan, which we can hold government to account. Because whether we like it or not, this is a government that is in power, it has been elected, and we can actually hold it to account for both its omissions as well as its actions in, using our constitution.